No one knows the day or hour when their regular pattern will be interrupted. Our current scenario can change quite instantly from one of carefree independence to one of complete dependence on a surgical team in the operating room. There are many hazards in the operating room. At a glance, the simple need to lay immobilised on an operating table may not seem so hazardous, but foam can bottom out. Positioning devices can put pressure on bony prominences. Post-operative pressure injuries can be serious and debilitating. The Waterlow scale is an internationally recognised tool and offers one example of assessing a patient's level of risk for developing a pressure ulcer. For example, an orthopaedic or spinal operation lasting just 2 hours would score 10, and this already places a patient at risk. Additional information regarding the patient's age or weight and medical history can very quickly increase that risk. It is well documented that pressure ulcers are, in most cases, preventable. Preventative measures for surgical patients are therefore paramount. Trulife silicone gel pads redistribute pressure effectively. They won't bottom out. A large percentage of general operations are performed in supine position. The main bony prominences at risk include the head, scapulae, elbows, sacrum, ischial tuberosities, and the heels. Head rings redistribute weight away from the occiput to the greater circumference of the head. Occipital pressure ulcers can cause alopecia. For ENT and ophthalmology procedures, a headrest with more lateral support is often required. Heel rests are also designed to lift the heels free of any pressure. In many studies, heels are the second most likely pressure ulcers to be observed. We have many innovative options to assist in the abduction or adduction of the arms. The ulnar nerve runs superficially to the elbow and is always at risk of being damaged. Trulife silicone gel pads reduce the level of shear and friction often associated with tissue damage. Cardiac and vascular procedures can be lengthy. Pressure on the sacrum and lumbar spine can be prolonged. The universal table pads provide a good basis for relief of the sacrum and ischial tuberosities. However, the Azure Sacral Protector is a unique product designed to further reduce pressure buildup on the sacrum and to reduce lumbar strain. Trulife silicone gel pads can be used safely in conjunction with warming blankets and mattresses during such cases. Place the gel pad over the mattress and gel will conduct the heat safely. Universal positioners can be used to optimise a patient's position for surgery. This is much more effective than sandbags, which can increase pressure significantly. For orthopaedic surgery, positioning on a fracture table can put the pudendal nerve at high risk of damage. Trulife silicone gel pads help dampen the impact associated with hammering, drilling and chiselling. Many genitourinary and gynecological procedures are performed in lithotomy position. For the patient, lithotomy is the one position with most potential for injury. The use of stirrups to position the legs will increase the pressure on the sacrum and lumbar spine. The crutch stirrup pads cushion and redistribute pressure on the popliteal fossa. Height of stirrups and angle at which flexion and abduction of hips is set will determine the level of pressure on the popliteal fossa. Pressure in this area can result in damage to the perineal nerve. The lateral position is often required in orthopaedic surgery as well as other specialities. Areas at risk in lateral position include ears, eyes, shoulders, elbows, hips, knees and ankles. An open head ring relieves all pressure on the ear while ensuring that there is no pressure on the eyes. The Elite Lateral Positioner ensures an excellent anatomical position for thorax, shoulder, head and neck. pressure is redistributed very effectively over a larger area. This also allows for good alignment of the arm. The lateral positioner can still be used even if the surgeon plans to break the table. Some of the gel pads can be adhered to positioning devices. A small gel pad can be used between the bony prominences of the knees and ankle booties for the lateral malleoli. A leg positioner can assist with good surgical alignment for hip surgery. It also allows for the lower limb to be flexed, which is very important for patient comfort and safety. Trulife silicone gel pads are X-ray translucent and MRI compatible. Surgical and anaesthetic needs are also design considerations. The prone position is a prime example of this. The Oasis Elite range of products have been designed with such considerations in mind. Effective design of a prone headrest is vital in assisting with airway management as well as protecting soft tissue of the face. Prone positioners facilitate good surgical alignment and allow adequate ventilation by eliminating pressure on the abdomen. For staff, health and safety issues are also important. Larger positioners can become heavy and cumbersome. The use of foam reduces weight of larger positioners while allowing for pre-contoured gel positioners. The principles of positioning in paediatric surgery are the same, and there are a number of products suitable for this use. Trulife gel pads are also latex-free, easy to clean and disinfect between surgical cases, and more hygienic than many disposable foam options. The prevention of pressure ulcers is an important intervention that will save thousands of patients from unnecessary harm. The Trulife pressure care ranges are a simple and cost-effective solution with a comprehensive offering to cover all surgical procedures. A good patient advocate in the OR is key to successful patient outcomes.